Hello, and thank you for attending the presentation, Continuity of Care During the COVID-19 Pandemic, Qualitative Results from a Mixed Method Study. My name is Michael J. Demmel. I am a postdoc fellow working at the University of Cape Town and an affiliated researcher at the University of Geneva. We have been working on a mixed methods research project regarding the continuity of care for at-risk patients during the COVID-19 pandemic in Swiss primary care settings. And this has had several sub-projects. So the underlying question that we had about continuity of care for at-risk patients, especially at the beginning of the pandemic, was the contradictory messaging around at-risk patients who we are told should stay at home. But these are people, if you think about it, that do depend on regular visits outside of their home with healthcare practitioners. We've finished a quantitative analysis of the intensity of health services use during the first shutdown during the spring of 2020 in Switzerland. And this study has been published in the International Journal of Public Health. We've almost finished, and that's being presented at the same session by my colleague Yael Rahamin. We've worked on this quantitative analysis of health service use during the entire year of 2020. And what I'll be talking about for the rest of this presentation really looks at the qualitative work we've been doing, which involves analysis of the experiences and perspectives of at-risk patients and general practitioners in Switzerland. So the questions that we are trying to collectively answer with all of this work have to do with the following. To what extent did the pandemic affect the health services use and provision of at-risk patients in the primary care setting throughout 2020? Second question, how did GPs in Switzerland provide continuity of care for at-risk patients throughout 2020? Third question, what challenges did at-risk patients and GPs face in ensuring continuity of care for both themselves or for their patients, respectively, throughout 2020, and how did they address them? In order to do this, we conducted qualitative, semi-structured interviews in two regions of Switzerland, the German and French-speaking parts. We did 23 interviews with general practitioners, and then some of their at-risk patients, 36 of them. These are patients who sought non-COVID-19 related cares from March 2020 up until the time of the interview, and the interviews took place between January and March 2021. For the general practitioners, we created an interview guide that involved questions about their background, their training, their work environments, where they were getting their information about COVID-19, what were their work experiences like, how they sought to treat at-risk patients during the pandemic, and then any recommendations they would have to improve practices for the future. We also had an interview guide for the at-risk patients that had questions about their backgrounds and their health status, thinking about socioeconomic variables here, looking at health services used during the pandemic, and then what were their experiences like as at-risk patients during this particularly challenging time. We analyzed our data with the support of the framework method, and we also used MaxQDA software. So what did we actually find out? So as you can imagine, 59 qualitative interviews, many of them lasting up to 1 full hour. We had a lot of data. So we had some results regarding the reductions in consultations for at-risk patients. We saw that some patients were discouraged from seeking care by the official recommendations and or their general practitioners during the first semi-shutdown. And for this, we saw that there was a lack of clear guidance about what was considered urgent, with recommendations telling patients to only seek healthcare services for cases of emergency or in urgent times. Some patients perceived GP offices as being closed or overburdened. Some patients sought alternatives to traditional primary care consultations. This, we saw they were either trying to have teleconsultations over the phone, they were trying to consult pharmacists or other professionals, or some of them relied on themselves or their personal network. For at-risk patients and the continuity of their care, we saw that GPs commonly described 2020 as an intense period, and they also talked a lot about how there were constant adaptations. And here we include a picture from one of our colleagues showing how they had to install this plexiglass in the GP practice. Many patients did not feel that there was actually a discontinuity of their care, even during the first pandemic wave in spring 2020. GPs, for their part, described feeling like an underutilized resource during the pandemic and explained how they could have been better mobilized to help the population. So, what does this actually tell us? Our qualitative data offers explanations for health service use reductions that we saw quantitatively. We also saw during the first wave of the COVID-19 pandemic in Switzerland, there was a mismatch between how GPs reported being available and prepared to adequately care for at-risk patients. And some GPs also discouraged at-risk patients to come for consultations. At-risk patients had perceptions that their care was not urgent during the pandemic, and patients perceived that GPs were unavailable or overburdened. What our results ultimately show is that how, from a health system perspective, GPs were an underutilized resource and they could be better mobilized in future pandemics through improved communication channels with patients, among themselves, and with health authorities. So I thank you for your time.